The biliary system has two parts, one inside the liver and one just outside of the liver. In this illustration we see the extrahepatic portion. It is composed of the right bile duct and the left bile duct. These join together to form the common bile duct. The cystic duct connects the gallbladder with the common bile duct. The common bile duct lies parallel to the hepatic artery and the portal vein in the hepatoduodenal ligament. The biliary system is like a leafless tree. From top to bottom, the diameter of the bile ducts gets thicker, from the liver lobules to the hepatoduodenal ligament. The underlying architectural basic structure of the liver is the liver lobule. The portal triad at the corners of this hexagonal field consists of a bile duct, a portal vein branch, and a hepatic artery branch. While the blood flows inward toward the central vein to get drained, the bile flows in the opposite direction to be drained by the bile ducts. The portal triad consists of a portal vein, hepatic artery, and bile duct. This structure is also called the triad of Glisson. It is always surrounded by echogenic connective tissue, which makes it easy to spot on ultrasound. This sign is also called the Mickey Mouse sign. The head and ears of Mickey are easy to see on ultrasound because of the echogenic connective tissue surrounding the portal triad. The vessel with the biggest diameter is the portal vein. The ears are the hepatic artery branch and the bile duct. In this illustration you can also see the inferior vena cava, the abdominal aorta, the vertebral column, and the gallbladder when using a cross-section over the right liver lobe. Here's the Mickey Mouse sign on ultrasound. Its ears are very tiny, but the echogenic connective tissue still shows their shape. How can we tell the difference between a portal vein and a hepatic vein? On the left you see a portal vein with the surrounding sheath of echogenic connective tissue. On the right there is clearly no echogenic connective tissue surrounding this vessel structure here. So this is a hepatic vein leaving the liver. If we scan in a cross-section over the center of the liver and we angle the probe to 45 degrees to the cross-section of the body, we can see the jumping stag sign. We can see the bile duct riding atop of the portal vein branching, also known as the central biliary branching here. And we see the aorta, the inferior vena cava, the vertebral column, and the right kidney. This is what the central biliary branching looks like on a still ultrasound image. We see the echogenic connective tissue here. We see the bile duct riding on top of the portal vein branching. We see the little bit compressed inferior vena cava, the vertebral column, the aorta here, and the right kidney here. I'll give you a second to look at this. Going into a shoulder umbilical line, we can see the cystic duct joining the common bile duct. We can also see the portal vein and the long section of the inferior vena cava. Here is the vertebral column, the gallbladder, and the psoas muscle. Here you see the cystic duct joining the common bile duct in long section, running towards the pancreas head. We see the portal vein, the inferior vena cava here, the psoas muscle, the vertebral column, and the gallbladder. Take a second to take a good look at this image. We stay in this position to examine the common bile duct in long section. We can also see the portal vein. We see the aorta and the inferior vena cava, the vertebral column, and the pancreas. On this ultrasound picture, we see the long section of the common bile duct as it enters the pancreas head. We see the portal vein joining the common bile duct in the hepatoduodenal ligament. This is the major landmark of the liver hilum. We can also see the aorta, the inferior vena cava, the vertebral column, and the pancreas head. Take a second to study this image.